World Health Organization this week declared the Mpox outbreak in Africa a global emergency. The alert, the second in 2 years, comes after an outbreak of the viral infection in the Democratic Republic of Congo spread to neighboring countries. The outbreak happened despite repeated calls from African researchers for increased global investment in diagnostic, therapeutic, as well as infection-preventing tools for Mpox. It exploded globally in 2022, prompting the WHO's first international emergency declaration, which lasted for 10 months. More than 15,000 Mpox cases and nearly 500 deaths have been identified on the continent, representing a 160% increase since the previous outbreak. Joining us now is virologist Professor Tulio De Oliveira, who's joining us via Zoom link. Prof, a very good morning to you. Thank you so much for making time for us this morning.
Good morning and good Sunday to all your viewers.
Prof, I want to start off here. So the SADC summit, the 44th Ordinary Summit, has just concluded in Zimbabwe. And in the communication, they make note of the declaration that has been made by the WHO as well as the CDC here in Africa. One of the issues that they say is that the summit has directed the Secretariat to convene an urgent meeting with the Ministers of Health to assess the impact of Mpox and to facilitate coordinated regional responses to control the spread of the disease. What should that meeting or those meetings entail to ensure that we are able to contain the spread of the disease?
Okay, thank you, Adrian. So the first thing, it seems that the Africa CDC, I saw a tweet from the Director General, was with multiple presidents of the region, that they are taking quite serious the Mpox outbreak. Yeah, but what we need, the first thing that we need is no panic, is no reason to panic, but to just deploy the tools that we know that work to control outbreaks and epidemics, which is three main ones. The first one, it's making the public know that such disease is spreading. I think that's important, scientists and media to be talk about that. So when people see similar symptoms, that they present for testing, and that they also reduce the risk behavior, The second one, it is detect the pathogen and the different clades accurately. So we are talking about improving diagnostic access to Africa, and that's where we enter. So it was our team with collaborators from the Democratic Republic of Congo that identified the new clade, the 1B of Mpox in the DRC, and then to increase diagnostic and genomic surveillance. And the third one, it is then to have what we call the medical countermeasures, which at the moment we have efficient vaccines, and that should be made available in proper numbers, to the African regions that are facing the most severe outbreaks.
Yeah. The communique, I'm going to go back to that communique from SADC. Again, they speak about the summit extended solidarity and support to its member states member states affected by Mpox, and further requested the World Health Organization, the Africa CDC and other partners to avail resources towards the Mpox response in the region. What do those resources look like? What do those tools look like? And are those tools only tools that we can find on the continent, or is this a clarion call to say that even countries that are not necessarily part of the continent, or where you don't have infections, to also come to the party to avail those tools and resources?
Okay, thank you, Adrian. So I think that the most important thing now is to make sure that these tools and resources are available where the outbreaks are happening in large numbers, such as the Democratic Republic of Congo. They are a member of the SADC region, And which resource we are talking? I think the resource that limited resource that we worry the most is access to vaccines. For example, what we saw with the COVID pandemic or even with the Mpox emergence that happened 2 years ago is that when we have a pathogen that can cross borders and transmit across, the rich countries, they hoard, they basically take all the vaccine stocks and the diagnostics. So I think that the most important thing now is to make sure that these resources, the vaccines, diagnostics, and support for medical staff to treat patients are available where the outbreak is happening. Because in the end, it's so much cheaper and so much efficient to control an outbreak close to the source than to wait when it is widespread.
Yeah, a point that is also raised in this article that was penned by Wolfgang Praiser as well as Cheryl Baxter from the Stellenbosch University is this point that you raise now. They say that since that declaration that was made in 2022, there was increased research funding that led to the surge in scientific studies. On just one medical research engine, there was more research produced since April 2022 than the preceding 60 years. So how do we change all of this? As you mentioned again, during COVID-19, this was also a major issue which the president of the country had referred to apartheid vaccines.
Okay, thank you. Yeah, first, the article that was wrote by Dr. Cheryl Baxter and Dr. Wolfgang Praiser, they are both very close to me. Cheryl is the head of my scientific program. Yeah, and they were just highlighting that when the resource exists and there is also willing, yeah, African scientists can almost lead the world on scientific research. Why that is because they got very used to deal with epidemics, yeah, and to characterize this pathogen, which has been transmitted in Africa for the past 50, 60 years, but completely neglected, yeah. And only when to happen a global outbreak, especially in the global north, in Europe and America, that the resources were available. So we have learned a lot of this pathogen. So our last main learning point was the emergence of this new variant, or which technically in Mpox we call clade 1b, which our group helped to characterize. That was a big jump on evolution, allowing the clade 1, which normally is restricted to transmission between animals, small mammals, to humans, to start being transmitted between humans, sexually transmitted infections, yeah. And once we know that, then we can really identify the networks that's happening, and then deliver the medical countermeasures that I mentioned, such as vaccine diagnostic and the public awareness.
Yeah. Then let's look at the disease itself. What is it about this Mpox strain that has made it so viral, considering also the number of deaths that have been reported so far? It seems that we are much closer now to the previous tally of around 200, with the previous outbreak being surpassed by triple the numbers. We're already over 500 deaths that have been confirmed so far.
Okay, so there is two main confounding aspects there. Yeah, most of the deaths, very unfortunately and very sadly, happen in very resource-limited settings, such as rural areas of Central Africa with very limited access to good healthcare facilities. Yeah, and that's one of the reasons why we think that the deaths are inflated from this clade. Yeah, what we saw when the variant that emerged, the clade 1b in Eastern Democratic of Congo, that has spread now to Rwanda, Uganda, and Burundi, and some infections in Kenya, is that clade we didn't see a very high case fatality ratio. Why that? That may also be confounded that starts spreading more in urban settings and infecting young adults, which tend to be much healthier. Yeah. So there is still a lot of questions to be answered about this new clade of Mpox, the 1b, that was the reason why the international emergency was called by the World Health Organization and the Continental by the Africa CDC. And that's why groups like ours, of some fantastic scientists and colleagues at the Democratic Republic of Congo and Burundi and Rwanda are really working day and night to understand more about that pathogen. Yeah. But what we know that most of the symptoms will be lesions. Yeah. And a lot of the lesions, it will be appear near the genital area, which is a sexually transmitted virus, yeah, and that they can be treated and people can be vaccinated. So there is no reason to panic. What we need to do is just to be alerted and make sure that the resources exist, as the SADC mentioned yesterday, at close to where the outbreaks are happening.
Yeah. Is it airborne at all? And why is it that when it comes to the cases that we are told that men, especially men who have sex with other men, are more at a higher risk of contracting the disease?
Okay, so first, this virus is not airborne transmitted, yeah, and that's why we see the cases not in hundreds of thousands and millions as we see in an airborne transmitted virus such as influenza or COVID. So this is a virus that's transmitted very similar as HIV, yeah, another virus that we know that's sexually transmitted, yeah. So why a man who has sex with men was the global main outbreak in the last 2 years? That's because very similar with HIV, yeah, this virus, they do thrive in sexually transmitted networks, especially close linked ones, yeah. And that's what we call the other strain. So at the moment we have two epidemics. Yeah, we have one on men who have sex with men that's caused by the lineage 2B. And we have one that started in the Democratic Republic of Congo and spread into the neighboring countries that transmitted between heterosexual people. This means like we have the same number of infections there as women and men, yeah, and that is sexually transmitted, and that's the new lineage that was described as 1A, 1B, and that's why our emergence was called to deal with that, because we know that heterosexual transmitted networks are much bigger in Africa, and that's why it's important to contain this outbreak. But the same things that work for HIV, AIDS, would work to contain Mpox.
Yeah. And finally, what's the risk to South Africa's health system and its ability to respond? And I see that, for instance, the EU, there has been an alarm that has been sounded in terms of travel alerts that have been sent out to the people. What's the major risk here?
Okay, the major risk for South Africa is that people that acquire Mpox and are also HIV infected and not on antiretroviral therapy, they tend to develop much severe symptoms. But that's not only with Mpox, it's also with tuberculosis and other pathogens. Yeah, people that's immune suppressed because HIV will get much sicker. So what South Africa and people can do, I don't think that we're gonna have a massive outbreak. Yeah, that's to the best of my knowledge, but would be very wise that we also continue investing more in our HIV/AIDS program, which at the moment the treatment to treat HIV positive people, it is absolute phenomenal. We have never had such good tools there. So if we control people HIV, yeah, even if they get Mpox, they are not likely to develop severe symptoms and disease.
Yeah, thank you so much for your time. That is a virologist there, Professor Tulio De Oliveira, on the Mpox outbreak and also the risks that are out there for a country like South Africa, which is, of course, on the SADC region. And as you just heard, that communique that came from the SADC summit is to have the Secretariat set up a meeting amongst the health ministers in SADC to control the spread of the virus. Still to come here on Newsfeed AM.